Hello, everybody, and welcome to Frontier Nursing University virtual event for National Nurse Practitioner Week. I'm Dr. Lisa Chappell, the Associate Dean of Family Nursing, and our presenter here today is Danny Webb, who is an alumni of the FNP program at Frontier, but is also a current preceptor. This session will explore the impact of preceptors and the importance of their role in educating the students. So, Danny, can you, first of all, share a little bit about who your preceptors were and how you connected with him or her?
Okay, so when I was in school at Frontier, I actually had already, when I applied to the program and was ultimately accepted and was doing my coursework, I'd made a decision at that point to go ahead and start looking into finding preceptors because I knew it was not such an easy task. And so in doing that, I actually chose to seek some nurses that I had known that had gone back to school to finish their nurse practitioner degree. And so I actually had 4 preceptors. My main preceptor was one of the local nurse practitioners. Angela Tipton is her name, and I had worked with her as a medical assistant many years ago, and I did the majority of my preceptorship with her, as well as Julie Dyer, who is also a nurse practitioner here in the town I live in Gainesville. And I found both of them through knowing them as nurses and through seeking out their advice as to how to go forth looking for a preceptor. And in doing that, they worked in a multi-specialty practice, and they gave me leads into other people. For example, a midwife that I could go spend time with to get those clinical hours done and those experiences completed, as well as pediatrics. I spent the same clinic. So I was able to I was lucky in that, or blessed, however you want to look at it, in that I was able to complete my whole thing through doing it in one clinic. So I spent my time from pediatrics, gynecology, OB, as well as adult health. I spent it in one location. So I really did, though, start seeking that out when I actually started doing my coursework at Frontier.
So it sounds like you really utilized your network that you had established to identify preceptors and then use those preceptors to identify additional preceptors.
Absolutely. And I think that's really kind of how you have to do it. And I also recommend, when you're doing this, because a prime example of something that happened is that when I had sought out Angela, she then changed roles with the organization that she was with and left the office and started doing a house calls program, which she then was pulled out of the clinic. And then that's how I ended up with Julie, and because I needed more clinical time than Angela was able to afford me because she was actually doing house call visits.
You said something else that I think is really important too, and that was to start early. Start
Absolutely.
early seeking your preceptors. Good.
And I think you have to also, I always tell people you want to map out clinics and you want to come up or potential clinical sites, and you want to come up with that quickly and kind of have an idea of how far you're willing to go from home to do your clinicals. Because if you have that already mapped out and in mind, I think it makes your clinical rotation much easier.
That's great advice. Thank you. How would you describe your experiences with your preceptors?
I mean, I had a great experience. I can't say enough good things about my preceptors. Everybody was very willing to help me learn and teach me and help me to transition to the role of the nurse practitioner, because it's very difficult as a registered nurse when you're making this transition and learning what it's going to be like to be a provider. It can sometimes be overwhelming, and learning how to transition that role is kind of difficult. But more importantly, I think that what I learned most from my preceptors is that it's okay to ask questions, and that the time that you spend in clinicals is such an important time because it gives you the opportunity to ask questions and find more things out about what it is that you're treating, and realizing that not every patient is going to respond to the same treatment, and you're going to have to really be open-minded in your treatment modalities and your critical thinking skills.
Excellent. You may have already answered the next question, which is, what is your biggest takeaway from the time with your preceptors?
I think the biggest takeaway from my time with my preceptors is that you become part of a network. And when you're a student, you kind of feel like you're not necessarily in that network of providers because you're still working as a registered nurse. And again, you're transitioning into the role as the nurse practitioner. So what I learned was that knowing and meeting these preceptors and learning things from them, it allowed me to network, which ultimately led me to getting my job, my current job, which is at the clinic that I actually did my clinicals in.
Ah, very nice. How has your perspective or outlook changed after working with your preceptors?
Well, again, I think the biggest thing was just learning that, networking. It never hurts to have that network of individuals that you feel like you can reach out to. I actually worked in the urgent care department in the current clinic that I'm in. And when I was in that role, I was able to reach out to the individuals in the gynecology department or OB department when I had questions or concerns. And it just allowed me to have that ability and feel comfort in being able to reach out to those individuals just to get more help or if I had questions and things like that.
I agree that network of resources is so important in practice. We all need that.
Absolutely.
Danny, can you share one thing that you learned from your preceptors that has impacted your career today?
One thing that's kind of hard. If there's one thing that I did learn is that, everyone makes mistakes. And in making those mistakes, you learn from them. And it doesn't necessarily mean that you're making a mistake that's detrimental to the health of the patient, but it's a learning experience. And what I learned from that is that it's okay. And you don't always have the answers. You're never going to have all the answers. I've been a nurse practitioner for 6 years now, and I still don't have all the answers. And I spend many of my days researching things, and our jobs are very interesting in that we learn something, or at least I try to learn something every day. It certainly makes my job very interesting. And again, it just is one of those things that you realize that you don't and you won't ever have all the answers.
That's very realistic too for practice. What would you say to a nurse practitioner that is unsure about being a preceptor? And a second part of that question is, would you talk about your own experiences of being a preceptor to current students?
Sure, absolutely. So I think, a lot of people get very nervous and anxious when you think about taking a student on. And in the beginning, when you get a student who's kind of new and they're, a little green still, you take them on and you start working with them. But the one thing that I really love about the Frontier experience is, and that is being the, part of the alumni group. And I just know that when these students come on, they're really eager to learn. And once you get the students in the groove and they get your routine down and they start moving forward, it makes your day actually easier because you have someone else that's helping you to kind of see the patients, and it doesn't slow you down. I know that's one of the biggest concerns I've heard when people ask me, what do I think about precepting? When other nurse practitioners ask me, they're like, well, it's going to slow us down. Our productivity is going to go down. We're not going to be able to see as many patients. Well, it will in a sense. But the other thing is, and this is what I love about having students, is there are things that change literally, it seems like almost weekly. And so what helps me is that students come forth, and if I have something going on, they know the latest and greatest, and they can help me understand that when I'm treating a patient. Well, now this says that we should do this depending upon what's going on. So it really does help me as a preceptor to kind of keep up on the latest and greatest things, and gives me the ability to kind of actually learn from my student.
That's a great point. Absolutely. Was there anything you'd like to add to encourage someone to become a preceptor?
Sure. Again, I can't say enough good things, not because I'm a Frontier alumni, but I can't say enough good things about Frontier. The quality of students that Frontier produces, there is no measure. I've precepted students from other universities, and that's not saying anything bad about another university, but just precepting Frontier students has been awesome. You get really good students, you get quality students, and more importantly, you have access to the Frontier staff, and they make sure that your preceptor time is so much easier. If I have an issue, I know who to call. The RCF that is with my students has been great. They stay on top of things. I know where my students stand. I know where they should be. And it just, I can't say enough good things about that. And in general, I feel like we should give back to our profession. We're not getting any younger. And so I think by giving back to our profession and precepting, it just really, it's going to make a world of difference. And it just helps, our profession so much.
Okay. Thank you very much, Danny, for taking time to come and present in this recording. And
Absolutely.
audience, I hope you found this to be very helpful, and thank you for viewing it. Good night.
Good night.